Welcome to Security Heroes, a podcast by Athena Security. We share real-life stories to help connect you to real heroes in the security world. I am your host, Lisa Falzone. Warning, the following recording contains potentially disturbing content. Listener discretion advised. So joining us today is Paul Sarnese, a vanguard in the realm of healthcare safety and security. As the owner of Secured and Prepared Consulting and a distinguished 2022 Campus Safety Director of the Year, Paul's expertise extends through the multifaceted spheres of safety, security, emergency preparedness, and regulatory compliance within healthcare settings. With a past presidency at the International Association for Healthcare Security and Safety and over 2 decades of leadership at Virtua Health, Paul has been instrumental in innovating and managing comprehensive safety and security programs that have safeguarded countless lives. His strategic foresight and commitment to excellence have not only established secure environments, but have also cultivated a culture of preparedness that resonates across the healthcare industry. Welcome, Paul.
Oh, thank you, Lisa. Really a real pleasure to be here with you today.
Yeah, so excited to have you. I mean, everyone you are like a legend in the security space. So I'm just so excited to have the Paul Sarnese on this podcast. I've heard about you from so many different people, and you're just so well respected within the industry. So,
Well, thank you. It's very, very humbling, and I'm sure you can see my face getting pretty red right about now.
Anyway, just to start off, can you just take us back to the roots of your journey in security? Was there a defining moment that steered you towards specializing in healthcare security? And what were the main factors that attracted you to this specific domain?
Yeah, well, I can actually thank my brother. So my brother was working as a security officer at a local hospital in Camden, New Jersey, and he had an opportunity to join the police academy. So his position became available. So at the time, I think I was right out of high school. I was a lifeguard at a local pool. Kind of love that feeling of keeping people safe and kind of being in that leadership role. And my sister worked at the hospital at the same time, and they encouraged me to apply. I applied for the job. I was fortunate enough to get it. I was actually under 21, and at the time, they were only hiring officers that were 21 and above because of insurance reasons for driving vehicles. So they had to make a bit of an exception for me. So I was the youngest security officer to join this department. And I think because I was the youngest, I was assigned to the emergency department the majority of my shifts. So I kind of fell in love with the role of keeping people safe and secure. And I saw the unbelievable work that happened in the emergency department, and the empathy and the compassion that was provided to patients that, came in, the worst times of their life. And I think it was pretty early on in my career, I realized just how impactful the healthcare environment was, and how meaningful it was. And I can tell you I'm a pretty emotional guy, and I can tell you that there were times when I just saw miracles being performed to save people's lives.
Wow.
You get to see, unfortunately, you get to see some of the worst things that people do to each other, but at times you kind of see the best in humanity. And I really fell in love with it. And I was blessed to work with great leaders who motivated me and mentored me to really grow in the career or grow in the field, and really invested, their time and energy into me. And because they were so good to me, I mean, I worked with Russ Jones, and Russ Jones, you talk about an industry icon. Russ took me under his wings and really taught me, how to be a professional in this industry. And so for the even until today, I feel like all my hard work is to really kind of give back to the industry, to give back to him for investing in me. So
Totally.
yeah, it was one of those things where you kind of go, I'm 58 years old. I still don't know what I really want to be when I grow up. I really don't. I mean, I don't know what my future holds. I love what I'm doing today. And it was one of those things when I start working in security, healthcare security, I fell in love with it. I really did. I fell in love with the industry, and really the ability to serve others and know that what I was doing was contributing to somebody getting well. I
Hmm.
wasn't touching them, right, as a doctor or nurse, but what I was doing to keep that environment safe and secure was helping others provide that outstanding care. So, yeah, it's definitely it's a passion of mine, and it's something that I'm really glad I kind of stumbled in the way I did, because it's just been just a wonderful experience.
Yeah, it's a common theme is everyone's kind of stumbles into it. I stumbled into it. A lot of people I have on the podcast sort of stumbled into it. It's just like you don't really know about it, and then you're like, wow, this is so cool. I can
Yeah.
save people's lives, and then I'm saving people's lives who are also saving people's lives. So it's pretty. I love it as well. So
Yeah,
um,
I kind of equate it to like being a teacher. Like
yeah.
where you know that you're changing somebody's life for the better, right? You're
Hmm.
impacting them, and I put healthcare right there.
Hmm.
It's very powerful.
Totally. You mentioned miracles that you've seen. Would you be comfortable talking about some of those?
Uh, so many, so many. I guess the one that stands out. I was working for a hospital in Philadelphia, and we had 50 overdoses in less than 20 hours.
Wow.
And yeah, there was heroin laced with scopolamine, which is a like a horse tranquilizer, an animal tranquilizer, and we were literally like a scene out of the movie. Cars were pulling up, five or six in a row, and literally
Hmm.
pushing people out of the doors that
Hmm.
were pretty much overdosed, and many
Yeah.
dead. And I
Wow.
think, yeah, talk about miracles. I don't think we had a fatality out of all of those overdoses. And it was the staff, literally the doctors and the nurses running out of the ER and performing life-saving care in the driveway of the hospital to
Wow.
save it. I mean, it was a scene out of a movie, like the worst movie you can imagine, where people all over the place, and laying in the street or being in cars, and I got to see people, what I believe was performing miracles to save those lives today. And this was before, like, Narcan was such a, you can go to a corner store and buy Narcan like you can today. You go to a corner pharmaceutical store and buy it. But they were using Narcan, but it was something that was, certainly not as pervasive as it was today, and it was just a miracle to be part of that.
Wow. That's crazy. 50 overdoses.
Oh, it was crazy. It was crazy.
I'm
If
sure you
you're
have a lot of stories like that.
too many.
Yeah.
Yeah, well, I think that's one thing about healthcare, and I always tell people that are coming into the profession for the first time is you're gonna have some crazy stories to tell. You're gonna see some
Right.
things, you're gonna smell some things, you're gonna experience some things that you never thought you would before. And it's no different than a police officer, a firefighter, or any other first responder, or anybody
Totally.
that's served in the military. It's you see some things that you were not expecting to see.
Yeah, totally. Can you talk about some heroic actions of either you or your security team that you've seen and just want to highlight?
There's so many. I think the one that comes to mind first, it was when I was working the virtual in our Camden facility. We had a gentleman that came in on a early Sunday morning with the intent of committing suicide. He had a box cutter and a screwdriver with him,
Hmm.
and he was actively trying to take his own life as he was walking into the facility. And
Jeez.
one of our security officers, and I apologize for forgetting his name because I would love to recognize him right now. But one of our security officers intervened,
Hmm.
got his attention,
Hmm.
tried to verbally de-escalate him, and really did, and started to have a good rapport with him. And on the video, you see that the gentleman's demeanor change, and the officer having that really good personal connection with them. Um, and then whatever happened, the individual started to stab himself with the screwdriver and the box cutter, start cutting himself with the box cutter. And our security officer intervened,
Wow.
physically had to intervene and stop this gentleman from taking his own life. And that was heroic in
Yeah.
itself, that because the officer put this gentleman's life in front of his. I mean,
Yeah.
he really had total disregard for his own safety, because he had, that was the compassion in him, and he didn't want to see this gentleman hurt himself, and he
Yeah.
he did what he had to do to protect this individual and himself. And we ended up recognizing him that year with a Medal of Valor through the International Association of Healthcare Security and Safety,
Cool.
because it was just exceptional work on his part.
That's awesome.
Yeah, it was really cool.
But yeah, what a great heroic story to recognize. Switching gears a little bit, can you describe the core mission of your consulting firm and how it aligns with the changing dynamics of healthcare safety and security in recent years?
Yeah, absolutely. So I left my full-time employment back in January of this year to really
Hmm.
concentrate on consulting 100% of focusing my 100% of my time and energy on that. So I've been around since 2002, and we're secure and prepared consulting is all about helping organizations identify risk. So we do safety assessments. So it could be an OSHA assessment, it could be a Joint Commission assessment. We do security assessments, so looking at the physical environment.
Hmm.
We do workplace violence assessments, and really, I believe we're the only ones who really take the approach of having a clinical expert and a security expert come together to do that workplace violence assessment. But things have changed. I mean, things have changed dramatically because workplace violence is certainly the number one focus in most organizations today. So that's really where the majority of our business is coming from, doing the workplace violence assessments. And organizations, there's so many competing priorities in healthcare. There's one bucket of money that everybody's competing with. So security is
Hmm.
competing with the OR and radiology, and they're certainly revenue generating, and security is not. And patient engagement, recruitment, retention, um, staff satisfaction, all of those things they're all competing priorities.
Right,
So how our focus has had to change over the last 20 years
right.
to not come in and say, oh, well, you need to add 100 security officers. That's how you're going to improve the campus, or spend all these dollars to
Hmm.
all this equipment and technology. We can't do that because it's not realistic. Organizations do not have unlimited funds, and there's competing priorities. So our focus has been really changed over the years to sit down, as once the assessment's done, is sitting down with the leaders and saying, okay, what do you have the appetite to move forward with? Because we
Hmm.
know there's no unlimited funds.
Sure.
So let's work together. What's kind of like the pebble in your shoe too. So it's funny. We take a different approach. So we talk about throughput, and we talk about clinical outcomes. We talk about how to identify high risk patients, how to manage the clinical records. We talk about a little different things than some other security consultants may look at. So when we sit down with the leaders, they already know that we're looking at things a little bit different. It's,
Hmm.
we're looking at things from a business perspective, looking at how we can improve their operation, and improve the safety and security of their campus, and improve retention, recruitment, and engagement, and all that. So the focus has changed now, where I think it's become more of a partnership with leaders of hospitals and healthcare
Hmm.
organizations to say, okay, where do we get the biggest bang for the buck?
Hmm.
What strategy, where is there evidence-based information that will prove that the strategy that we're going to recommend is going to have the outcome that you desire.
Hmm.
So we all know that healthcare is very focused on evidence-based practices, right? Very
Hmm.
slow to adopt new technology unless there's evidence to justify it's going to improve patient safety, or if it's going to have a return on investment. So it's been really a different focus, at least over the last 10 years, where now it's sitting down with the presidents or the CFOs, whoever we're sitting down with, and saying, okay, this is what we need to recommend. Let's start with the low hanging fruit. Let's implement the things that cost nothing,
Hmm.
and you're going to have an impact.
Yeah.
Now let's look at those things that we're recommending that are going to have a financial impact. Now let's kind of slice and dice them to determine which ones are going to give you the desired outcomes that you want. Because if it's staff engagement, we want to be able to measure that, right?
Hmm.
After we implement a strategy. If it's a reduction in injuries, we want to be able to measure that after we do
Yeah.
an intervention. So it's just really been focused. It's certainly more of a partnership than it's ever been with healthcare executives to really come up
Sure.
with what's the best strategy to move forward. Because workplace violence specifically impacts so many different things. I mean, I was at a hospital that just a couple of weeks ago, it was 3.5 miles away from another hospital.
Hmm.
And when I was interviewing the staff on the 11 to 7 shift in the ED, they kept on comparing their hospital to the one down the street. Well, the one
Hmm.
down the street has weapons screening. The one down the street has 24/7 security officers in the ED. We don't.
Hmm.
Well, I was able to share that information with the CFO of the organization. And it was eye opening for him because I had no idea our staff is kind of shopping themselves between organizations. I said,
Hmm.
absolutely. That's how
Interesting.
important employee safety is. They're going to
Yeah.
compare one hospital to another. And the scenario I used, because I think he was able to relate to this, was, he had college age kids. And I said,
Hmm.
before you chose and your son or daughter chose where they were going to school, you looked at the crime rates, right? You looked at what was the safer campuses.
Right.
Well, employees are doing that today. They
Yeah,
want to make
totally.
sure that they're going to safe places. So if there's a more robust or more mature or more robust security program or more mature workplace violence program, that's where employees are going to choose to go. And we all know, how bad the labor pool is and how tough it is today to recruit and retain people. So
Hmm.
it's important. And I don't think, 20 years ago that was part of the conversation.
Yeah, totally. I mean, you even see all these, strikes and these healthcare strikes, and the number one thing people say almost every time is workplace violence,
It
and
is.
huge reason why these nurses are leaving and they don't want to be abused, and they're currently
Absolutely.
being taking more abuse than police officers, which is
Yeah.
crazy. So,
I saw it. I just came back from a trip. I was at a conference in Portugal speaking, and I came back on Sunday, and
hmm.
there was an article that was posted on LinkedIn. It was a hospital in Washington State that the
Hmm.
nurses were protesting, and there's a sign of a nurse holding a sign up that says, "We need weapon screening. We need
Oh, really? That's
weapons."
hilarious. You got to send that to me.
Yeah, it's the
Yeah.
truth. I mean, and employees expect to go to work and be safe,
Totally.
and they should.
And the patients like it. I mean, as a patient, you want to make sure there's no bad guys in there. So one of the things that you said was interesting to me is that when you're doing the risk assessment, are you combining someone from clinical and
Yeah,
so talk to me about that because that's a lot different than what I hear from most people when they do the
yeah.
risk
At
assessment.
least I don't know anybody else that's doing it this way. So my,
Yeah.
my partner, Mitch Giesinger, Mitch is a nurse. He's a pediatric nurse. Worked for several consulting companies for a number of years doing
Hmm.
accreditation assessments and so forth. So
Interesting.
so we look at three things. We look at the workplace violence program. So we look at policies, procedures, training, the committee, the charter, key performance indicators, all those things that kind of combine kind of make up the program itself. And then we do the physical environment. So that's really what my area is, and I do access control and surveillance and emergency communication and officer deployment and training and all those other things. And then we
Hmm.
get the voice of the customer. So we're interviewing staff. But what really makes us unique is having a nurse on board.
Hmm.
So Mitch can look and sit down with he can sit down with the doctors and the nurses and talk about things like, what is your CWA protocol? So CWA is when when you have somebody that's withdrawing from substance abuse. How do you manage that behavior? How do you manage the
Hmm.
medication? So because workplace violence is not a security problem, it's
Right.
not.
Right.
It's holistic, and it's real important that hospitals have mechanisms in place for how do you identify a high risk patient when they walk in your ED?
Hmm.
How do you manage their medications? How do you develop a multidisciplinary plan of care to manage the patient's behavior or the staff behavior?
Hmm.
How do you maximize your clinical medical record?
Hmm.
All of those things are clinical. It has
Right.
nothing to do with the physical environment, but
Right.
they go hand in hand because one can impact the other. So we really do take a unique approach to it too. And we get some the feedback we get is amazing at times. We Mitch and I tell this story quite often, but we've had nurses cry right in front of us
Right.
because we sit down with them, on all three shifts, and we say, we're here on behalf of your organization. They care about your safety. How do you feel about your safety here?
Right.
How's the lighting in the parking lot at night? And we had on one particular occasion, it was you kind of get chills when you think about this, but a seasoned nurse in the ER started to cry, and she said, I can't believe that my organization cares as much about me, that they brought in outside
Yeah.
experts to sit down with me and for me to tell you the things that I know you're going to be able to go back to them and tell them that we need to fix.
Hmm.
And it was powerful. It was
Hmm.
powerful. And this, when you bring somebody in from the outside, I think employees are more open and honest. I think
Hmm.
it's, and I did this at one point with the COO. We were at a nurse's station, and I asked the COO to go up to the nursing staff and ask them, how do they feel about their security? And they were all like, "Oh, it's great. Everything's fantastic." And then I asked them to take a walk away, and I went back and I said, "Okay, so now how do you really feel?"
Right.
And they went like, "Oh, the lighting in the parking lot sucks.
Yeah.
The security staff from 11 to 7, blah, they kind of dumped on me."
Right.
And I was able to share that with the COO, and he was, I don't think he was that surprised,
Right.
but it was just, it brings a lot of, it's a powerful message that organizations send to their employees when you bring somebody in from the outside to do an assessment and to really get to the root of what the pebbles and the rocks in the shoes are to employees and to leaders, and then to work
Hmm.
with them to come up with a plan to address it, and then
Totally.
and then maintain that partnership forever. So, it's not like you walk in, you do the assessment, you say, "This is what we recommend." No, it's, "This is what we recommend. Let's help prioritize this. Let's have a discussion with the key stakeholders. Let's prioritize it. Let's implement it. Let's measure. Let's continue to work with you to help develop your program so you can be successful." I mean, it's, you have to have a passion for keeping people safe, right? And doing the right thing.
Hmm.
And that's really what motivates me, and that's kind of my why behind this. My why is, I want healthcare and all employees, but really focus on healthcare right now. I want them to feel safe and secure when they go to work, so they can provide great care to people and then go home to their family when they're done their shift. That's
Yeah.
the bottom line.
I love it. I can tell your passion is awesome. And I love talking to people that are really passionate about this. Speaking of which, like what do you see as far as like the physical, like for your company, and then also just security in hospitals? Like what's your vision for the future?
Well, I think we're continuing to demonstrate the value that we bring to the organizations, and just how
Hmm.
important the role of security is. It's where, it's not the afterthought that it used to be. I
Hmm.
really seen a tremendous change in the industry in the last 20 years, and I think it's because of the professionalism that our security leaders are bringing to the table. It's organizations like IHSS that are providing the training and education to leaders and providing that those resources for them. But we are seen as a partner, as a
Hmm.
required partner in this, and that we bring incredible value to the organization, and not just from a security perspective, but you have a lot of security professionals that are overseeing the environment of care and the safety programs and the drug diversion programs and safe patient handling and emergency
Hmm.
management and other maybe non-traditional roles. I think we're really being impactful, and we have a very strong voice. We have a very powerful voice, and we're very influential. The
Hmm.
security leaders that are successful are the ones that realize that you have to collaborate with the nursing staff, you have to collaborate with the medical staff, you have to be
Hmm.
a team player, because
Hmm.
healthcare is probably the most it's a team sport. There's not
Totally.
one department that takes care of a patient. It's multiple teams and multiple departments that are involved in there's multiple steps involving many different departments and people that have to be in sync to take care of patients. So I think that we're going to continue to grow as a profession.
Hmm.
I think our roles are going to continue to expand, and we're going to take on some more non-traditional roles that we may have in may not have in the past. I think because the workplace violence is getting the attention that it deserves, that we're going to be at the table every time there's a new construction project, every
Right.
time there's a renovation, every time there is a new initiative that's going to be discussed. We need to be part of the table, because all of those things impact us. Either the
Hmm.
environment that we're working in impacts that initiative, or that initiative is going to impact the environment in some way. So yeah, it's been remarkable over my career to see, just how much it's changed from kind of being the security department or the security guard that, is over,
Right.
and, that is really not getting a lot of attention or a lot of love from administration, who's now being seen as, we need to make sure that our safety officer, our security leader is involved in these discussions at the highest level, because they
Right.
have tremendous input and value.
Totally. You talked earlier about like the biggest bang for your buck of what you can do just to make your hospital safer. What can you just talk like a little bit more specifically about? what that would be
Yeah,
specifically.
so it's been pretty consistent. So this year, I visited 25, 26 hospitals. And there's two themes that come up all the time.
Hmm.
And it kind of changes if it's an urban environment versus a more rural environment. But,
Hmm.
you know, weapon screening is number one, and wearable duress buttons are number two. I mean, that's what we're hearing everywhere I go. And
Wearable what? Sorry.
it's a wearable, it's a RTLS, so it's real time location um,
Okay.
system. So it's basically it's a panic button
Okay.
that, you know, like, so we just did a survey through our foundation, and it was like 82% of emergency departments have panic buttons, but they're hardwired, right? So I got to get
Hmm.
to a computer, or I got to get to a nurse's station and push this button to get security or my colleagues to go.
Right.
Technology today is I can wear a device.
Hmm.
I push that button on the device. It sends a signal to my colleagues that can come and help me,
Cool.
or it
Yeah.
sends a signal to security and they come and get me,
Yeah.
or come and provide that support. So yeah, weapon screening and those wearable panic buttons are really what we're seeing most organizations evaluating, because overnight, and you know this, overnight you change the perception of safety and security on that campus. Overnight, you implement a weapon screening, and overnight your employees feel safer.
Yeah.
Overnight, your patients feel safer. They do.
Yep.
It's because you're preventing, you know, the unthinkable from happening, and that, you know, preventing those you know, mass casualty incidents, or an active shooter situation, or, you know, a really bad situation happen when somebody brings in a weapon.
Hmm.
So that's typically number one in the urban environments, followed by the wearable panic buttons. And then when I go to more rural areas, it kind of reverses. But that's really what we're seeing, and that's from a technology perspective.
Hmm.
Um, unfortunately, there are still some hospitals that are not training staff to how to identify and manage aggressive behavior.
Hmm.
They're just really starting to have those conversations. So if they already have like a mature security program, and they have some, you know, good access control, good surveillance, good weapon screening, visitor management, emergency response, and they don't have training, then we tend to kind of go down that path of conversations. Okay, now what type of training would fit your organization? You know, is it,
Hmm.
are you concentrating on dementia, delirium, autism, your general population? You know, do you have a certain niche population that you're serving? Because there's certain programs that are out there that are geared towards different populations. So, you know, it's sometimes it's a technology solution that we're recommending for the biggest bang for the
Hmm.
buck. Sometimes it is an increase in FTEs and security officers, depending upon, again, the posture that they currently have. So it's really been the full gamut of technology, people, training. Um, a lot of it too is data management, you know,
Hmm.
specifically for workplace violence. A lot of organizations are struggling with trying to identify, you know, their source of truth for data, because
Sure.
you have your employee health and safety data,
Hmm.
then you have your occurrence reporting system, and then you have your
Hmm.
security data.
Hmm.
So you have three different buckets of data. What are you going to
Right.
use?
Right. Right.
So a lot of our conversations with leaders are, okay, let's come up with the best data. So
Right.
we either pick a source of truth, which is kind of
Hmm.
hard to do, or you kind of filter through all those data points on a frequent basis to then say, okay, this is the best data we have. We want to make sure we're
Sure.
not double counting. We want to make sure that we're not, you know, missing certain incidents. And then, because we all know data drives every decision we make, data
Hmm.
drives every resource allocation that hospitals are going to spend. So it really depends where the organization is, you know. But that's kind of where we're at from a technology perspective and a people perspective, and data. It's really depends upon the maturity level of the hospital's security program and the workplace violence program.
Yeah, doc, and it sounds like you really work with clinical staff a lot. I mean, doctors obviously with the training that they just love the data as well. Same with the nurses. They
Yeah,
love like, you know, we before we had this many weapons coming in, now we have this many, you know.
yeah. I think there's some of the most analytical people you're ever going to meet.
Mhm, definitely.
It's all about evidence. It's all about
Yeah.
research.
Yeah. So in your tenure as the Assistant Vice President of Safety and Security and Emergency Management at Virtua Health, could you share a specific instance where an unconventional leadership approach you took led to a breakthrough in security management or emergency preparedness?
Yeah, I think the first one that comes to mind is we were deploying a weapon screening at one of our campuses. So I did a ton of research,
Uh-huh.
homeland security research, research for what hospitals were doing all throughout the world. And I stumbled upon an article about amnesty boxes,
Hmm.
and it was amnesty boxes for self-surrendering of drugs before before going into concerts in I think it was in Wales.
Uh-huh.
That's where I believe it was. And I was intrigued. So I said, amnesty boxes. I was in the Marine Corps. I know what an amnesty box is. You have it on the firing range. So when you forget, you forget the rounds are still in your pocket, that you can
Yeah.
drop them in the amnesty box before you walk off the firing range without
Right.
any fear of, retribution or reprisal, whatever it may be. Um, so I went to our leaders and I said, I want to try something. And they went, what do you mean? I said, I want to try this amnesty box and see if it works.
Uh-huh.
And nobody knew anything about it. So I said, let me fail. That was a conversation I had with our president at the time.
Right.
I said, please give me an opportunity to fail. And he started laughing. And I said, it's $600. If I fail, I'll own it, but let's try it.
Right.
So we deployed the weapon screening. We deployed the amnesty boxes, and we had we worked with marketing to come up with signage, and we kind of followed the path of our guest and made sure we had signs every path, every way into the ER that said, we're going to do weapon screening, but there's this box that you can self-surrender, and really the goal is to prevent the weapons from coming in, right? So if we prevented one knife from coming in, or one screwdriver, or one box cutter, I thought it would be successful.
Right.
So to make a long story short, we implemented the amnesty boxes. The second day that we had them deployed, we got a call from a media outlet, and it was through Leapfrog. And Leapfrog is a big organization that really is all about healthcare quality and safety.
Hmm.
And we determined that we were the first hospital in the United States to deploy these amnesty boxes.
Hmm.
And we had nothing but success at the one facility where we initially deployed it. So
Yeah.
we find out that we're the first in the nation to deploy these. We have great success on this one campus. We then deploy them system wide. Now I know of a lot of organizations that are deploying amnesty boxes when
Right.
they're considering weapons screening.
Right.
As a matter of fact, is part of the guidelines council from IAHSS. It's something that we've talked about including in our guidelines as a best practice.
Hmm.
So it's just one of those things where research led me down this path. I never thought
Right.
had nothing to do with healthcare. It was really the self-surrendering of drug paraphernalia before you went into
Right.
this concert venue, and I went,
Right.
let's try it. The hell,
Yeah.
what do we have to lose?
Yeah. I mean,
And now
sometimes
it's
like
become this almost industry, generally accepted industry
standard.
practice, which is pretty cool.
That's awesome. Yeah, and I like it because it assumes the best, right? It doesn't assume like everyone's a bad guy. It's like, okay, you might have forgotten to put your weapon away. Like here's a way to do it. I like that a lot.
Yeah,
So, and it
it was
doesn't,
cool.
yeah, it doesn't create this conflict. So
Yeah,
maybe I'll
and
suggest amnesty boxes more to our clients.
they work. They really do.
Yeah, yeah,
Yeah, it's
totally.
yeah. I'll tell you the other thing that came to mind too is, because I find great pride in seeing these being deployed in healthcare was, I was in Walmart one day
Hmm.
and I was checking out, and I must have saw myself on 15 different cameras or 15 different, TV monitors.
Right.
And I went, man, these things are really cool. We should really consider using these in healthcare. And I came back and I spoke to my supervisor at the time, and I said, I want to try something. Well,
Uh-huh.
what do you mean? I said, well, it's called a public view monitor. I just want to put it in one of our main lobbies and see if it works. We're going to
Yeah,
put this monitor up. It's going to say across the bottom, recording in progress. And I know it's going to be a deterrent. Anybody that's thinking
sure.
about doing something criminal, they're going to think twice because they
Right.
already know that they're on camera. And we all know that we act different when we're on camera, right?
Right.
So I've been blessed to work with leaders that have always given me that opportunity to fail. And so we deployed it at one organization, saw it work. The funniest was when you see somebody walk in, see themselves on camera, then turn around and walk out. um,
Yeah.
and so we tried it there. I end up I did a series of articles about what I thought the value of public view monitors were. and now you're seeing them all over the place in healthcare. And it's just cool. It's cool to be able
Yeah.
to be in that situation where, I think I had a little slice in influencing the industry to adopt some new practices, which was pretty cool. And you can't do that unless you have leaders that allow you opportunities to fail. And like I said, I've been blessed with great leaders throughout my career.
Yeah. Yeah. You mentioned, the ability to fail a lot. And I find in security, it's like people go into security because they're like, a little risk averse. And so it's like, but we still have to create innovation. And with innovation comes trial and error. And with the innovation sometimes
Absolutely.
comes failure. So I think having security leaders like yourself that aren't afraid to fail is so critical to the industry in general. So,
Yeah, you have to try
so thank
things.
you.
You're welcome.
Absolutely.
You have to try things. You're not going to know if they're going to, failure's not trying, right? So
Totally.
yeah, yeah, I've always been one to try different things, and if it fails, then you own it and you go, all right, well, I own that one.
Yeah, exactly. That's awesome. Well, we're running out of time. It's been fascinating talking to you. Just in conclusion, what are you most proud of
Oh,
in your
wow.
career?
Well, I think the teams that I've been able to build,
Hmm.
I think I've had this unique ability to see the value in people and what they bring to the table. I've
Hmm.
always surrounded myself with a diverse team. My wife would tell you, and I surround myself with very smart women,
Yeah.
and very diverse.
Right.
Age wise, culture wise, ethnicity wise, background wise, and I think I've always had a great knack of building strong teams,
Hmm.
and then I've always found great pride in watching the team succeed and putting the
Totally.
team first. And any team that I've ever been part of, they'll tell you that I was not part of our vocabulary. It was always
Hmm.
we, and what are we going to
Yeah.
do? And I think just like in sports, or any time you go through something with a team, you become
Hmm.
stronger.
Hmm.
And those relationships, they're lifetime.
Hmm.
And I still speak to colleagues that I worked with 30 years ago, and
That's
we
awesome.
and we literally say we love each other. When we say
Yeah.
goodbye, hey, I love you,
Right.
and my team would tell you, I would say it to them all the time, love you like brothers and sisters, because I did.
Yeah.
And I
Yeah.
think that's what I'm most proud of is the ability to have a team come together with one common mission,
Hmm.
um, support each other, be there for each other, celebrate each other's success. I think that's what I'm most proud of.
That's awesome. Well, thank you so much for everything you do and your leadership and encouraging other leaders and your vision for the industry and just most importantly, your passion. So
Thank you.
thank you so much for everything.
Thank you. I appreciate the opportunity. Thank you, Lisa.
Security Heroes is brought to you by Athena Security. To find out more about Athena Security and how we help save lives through our weapon detection solution, visit www.athena-security.com. And then make sure to search for Security Heroes in Apple Podcasts, Spotify, and Google Podcasts, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at Athena, thanks for listening.